I give consent to be a patient in this video.
Hello. Go ahead and get started by sanitizing my hands, making sure I'm nice and clean. So I'm going to go ahead and be using a stethoscope today to go ahead and listen to her lung sounds and her heart. And I went ahead and provided privacy. My name is Carla Vasquez, your student nurse today, and I'm going to go ahead and be giving you an assessment, and it's going to be over your thorax and your lungs, your cardiovascular system, and as well as your lymphatic and peripheral vascular system. Is that okay?
Yes.
I'm going to go ahead and walk you through it. If anytime you feel comfortable, just go ahead and let me know, and I'll go ahead and adjust it to you, okay?
Okay.
Can you go ahead and we can start off by doing it on the chair. If you can go ahead and take a seat for me, please. Okay, do you need a blanket to cover up or anything, or do you feel comfortable?
Yeah.
Okay, that sounds good. I'm going to start by looking at your suprasternal notch. Just going to be right here, and then following the suprasternal notch, I'm going to go ahead and be looking at the trachea, which is nice in the middle, nice and symmetric. I don't see any swelling going on. So from the suprasternal notch, I'm going to go ahead and be looking at the angle of Louis. And following the angle of Louis, it's going to be your second rib, which is located right here. And then I'm going to go ahead and state that this is going to be your mid-sternal line right here. And then this is going to be your mid-clavicular line. And then your anterior axillary line. And then following the anterior axillary line, it's going to be the mid-axillary line. And then the posterior axillary line. And then it's going to be your scapular line and then your vertebral line, okay? And in the front, your lungs are classified into different lobes. So on the left-handed side, you're going to have, this is going to be your left side. It's going to be 2 lobes. And then on your right-handed side, you're going to have 3 lobes, which is the upper, middle, and lower lobe. And when looking at your lungs from the back, you're going to have 2 lobes in the back, okay? So then, after doing that, I'm going to go ahead and be inspecting your chest. Your chest is nice and even. I don't see anything wrong with it. Let me go ahead and look at it really quick. Okay, everything seems fine. After looking at your chest, I'm going to go ahead and be checking your lungs, okay? I'm going to just ask you to go ahead and take a deep breath for me in just a second. Okay, can you go ahead? Okay, I'm going to go ahead and look at it in the back. Okay, can you go ahead and take a deep breath for me? Okay, everything looks good. Now I'm going to be looking at your trapezius muscles. And your trapezius muscles look pretty even. I don't see any overdevelopment. They look nice and good. After your trapezius muscles, I'm going to be looking at your skin color, which is nice and appropriate for your ethnicity. And then I'm going to go ahead and the patient looks conscious at what she's responding to. You understand what I'm doing?
Yes.
Something like that? Okay. And then her breath sounds also sound like perfectly good. I don't see any abnormal patterns. Her chest isn't moving like in an abnormal position. So I'm going to go ahead and be I'm going to be palpating the tactile formitis. So I'm going to need you just to say 99 as I go ahead and press down, okay?
99, 99, 99, 99, 99, 99, 99, 99.
I'm going to move to the back, and so for the vibrations, I feel all vibrations. They sound good.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. And everything sounds normal. I'm going to go ahead and start percussing your front of your chest, okay? Okay. Okay, nice. The resonance sounds good. Low pitched. Okay, I'm going to go ahead and be doing the posterior of your chest. Okay, so now I'm gonna go ahead and start auscultating. So I'm gonna go ahead and start listening to your lungs, okay? Just go ahead and take nice deep breaths for me, okay? Okay, so the breath sounds sound normal so far. Okay, so everything sounds good. Now I'm just gonna go ahead and need for you, every time I go ahead and press my stethoscope on you, for you to go ahead and say 99. And this is gonna be so that way I can go ahead and make sure the type of sounds I can hear from the patient, and whether if it's done stall or any abnormal sound it happens as well. Okay, can you go ahead and say 99?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, so this is also to help hear her voice sounds as well. So now I'm gonna go ahead and need you to whisper 1, 2, 3. Okay, now can you go ahead and say, you're gonna be saying E for me. Okay?
E, 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 E,
Okay. So everything sounds normal with her voice and her breathing sounds. I didn't detect any abnormal breathing patterns. Everything sounded normal. There wasn't any wheezing or crackling. So that's good. So now I'm going to go ahead and get started with the cardiovascular system. Okay, so what I'm going to need for you to do is to go ahead and lay down on the bed for me. Okay, can you scoot down from the bed just a little bit? And then I'm going to go ahead and fix the pillows. And I'm going to try to place the patient like at a 30 to 45 degree angle so you can go ahead and scoot down a little bit more. So I'm going to start by inspecting her jugular vein, and I'm also going to be checking her chest, making sure it looks normal, and the apical pulse, that it's rising normally, okay? So if you can go ahead and turn your head this way for me. So her jugular vein is nice and visible throughout her neck. Everything seems normal. And then I'm going to go ahead and be looking at her chest. Okay, and it's rising nice and normal. I don't see anything yet coming out. Okay, and after checking your inspecting, I'm going to go ahead and be palpating your carotid artery and also your apical pulse, okay? So, go ahead. Okay, there's a nice healthy heartbeat. It feels fine. Now I'm going to go ahead and feel your apical pulse. Okay, and both were nice and palpable. You have a good strong beat. Everything, the blood flow is going good. I don't detect any abnormal. So now I'm going to be percussing. So give me a second. So after doing that, I'm going to go ahead and be after listening to your apical pulse, I'm going to go ahead and start checking your heart sounds. So I'm going to be listening to your mitral valve and things like that. So I'm going to go ahead and get started. And there's going to be 5 areas that I'm going to be looking for. So I'm going to start off with your mitral valve. Okay. This is your aorta valve. I'm sorry. And then it's going to be your pulmonic valve. And then it's going to be your second pulmonic valve. And then I'm going to go ahead and listen to your tricuspid. And then it's going to be your mitral. Okay, everything sounds good. And I'm going to go ahead and listen to your carotid artery. You can just go ahead and take a deep breath for me and hold it for a few seconds. Okay. And then you can go ahead and take a breath. And then just take another deep breath and hold it in. Okay, everything sounds good. And after listening to that, I'm going to go ahead and that's going to be it for the cardiovascular system. So now I'm going to start for the peripheral and the peripheral vascular system, sorry. Okay. For that, you can go ahead and sit to the side of the bed for me, please. So I'm going to go ahead and be starting off with your hair. Your hair is nice and evenly distributed. You have nice brown healthy hair. It's not dry at all. Okay, you look healthy. I'm going to go ahead and be checking the hair throughout your body. Okay, you don't have any abnormal hair, girl. And now, after following her hair, like checking she doesn't have any overdevelopment of hair. It's nice and evenly distributed throughout her body. And she doesn't seem to have any new lesions throughout her body. Everything looks good. Can go ahead and look at your arms. She does have a few scarring, like one right here. You can go ahead and see that. Everything here looks good. I'm going to go ahead and look at your face. So she does have a scar on her chin. You can go ahead and see that, but everything else, I don't really see any new lesions. Everything looks good. Her skin is appropriate for ethnicity. It's nice and evenly distributed throughout her body. I don't see any patches of lighter skin. So after looking at your skin, your lesions, your hair, I don't see any viscosities either. Her veins are nice. And so now I'm going to go ahead and be checking the turgor of your skin. Okay, so she's nice and hydrated. And now I'm going to be looking for any pitting, any swelling on her feet. Everything seems normal. There's no swelling. Okay, and now I'm going to be checking your capillary refill. And the patient does have her nails painted, but you can still be able to see. Okay, I'm going to go ahead and check this hand. So the right hand did refill less than 3 seconds, and so did the left hand. So now I'm going to be checking it on her toes. Okay. Okay, there's a good refill, less than 3 seconds. Okay. And might as well that I'm here, I'm going to go ahead and check for any calf tenderness. Do you feel any pain?
No.
Okay, everything seems good. I didn't see any, your capillary refill was less than 3 seconds, so that means your blood flow is going good. So now I'm going to go ahead and be doing the Allen's test, and I'm going to go ahead and be putting my fingers here, and you're going to be pumping your hand, and then I'll tell you when to stop, and I'll let go and see the blood flow rush to your hands, okay? Okay, can you go ahead and start pumping your hand? Okay, now extend your hand. Okay, so the patient has good blood flow towards her hands. There wasn't any abnormalities. So after checking the Allen's test, I would go ahead and I'm going to be checking your, this is going to be your ulnar pulse. Okay, so you have a nice strong beat to it. Now I'm going to be checking your radial. Okay, seems good. And then I'm going to be checking your brachial. Okay, go ahead and place your hand right here. And then after checking your brachial pulse, I'm going to go ahead and check your gluteal pulse. Okay, you have a nice strong pulse. And I'm going to go ahead and check it on this side as well. Okay, and now let me go ahead and check your radial and your lumbar pulse over here. So this is going to be your radial. It's a nice strong beat to it. Check your ulnar. And then your brachial pulse. Okay, now I'm going to go ahead and be checking your epitracheal lymph nodes. Okay, and let me check this one. Okay, there wasn't any abnormal swelling of the lymph nodes. And now I'm going to go ahead and be checking your dorsal penis pulse. Okay, nice and strong. Go ahead and be taking this one. And then also your post-tibial. Okay, she has a nice strong pulse, and be taking the post-tibial as well here. Okay, so I'm all done with my assessment and everything seems really good. Do you need anything else?
No, thank you.
Okay. I'm gonna go ahead and sanitize my hands. And that's it.